Hello everyone. So this is the head and eyes assessment for my 18-year-old patient who's at the clinic today. And before I start, I'm just gonna show you the room. And this is the room. This is like stuff right here and over here. That's my patient. And that's the rest of the room. Okay, so I'm just gonna put my stuff here. Brace it, I think you can see me. So before I start the procedure, I did hand hygiene, I cleaned my stethoscope, and I donned gloves on. So I'm just gonna enter and start speaking to the patient. Hi Sarah.
Hi.
My name is Mark and I'm the student nurse here. I was asked to come and do a head and eyes assessment on you, okay? Can I please have a look at your wristband? Can you please tell me your date of birth and your name?
August 11th, 1990.
Awesome. And are you feeling comfortable right now? Do you need to go use the washroom or have some water to drink?
No, that's fine.
Okay. So what I'll do, I'm going to close the curtain just to provide some privacy before we start, okay? Curtains closed. Now, my patient appears to be her stated age. Her sexual development is the same as her age, and her skin color is consistent with her Hispanic background. Now, my patient, height and weight seems to be normal. There seem to be no deformity, no physical deformity. Patient sits upright, and also bilaterally arms and everything is equal, okay? So patient did maintain eye contact, is cooperative, patient is well dressed and groomed, and patient facial expression is appropriate and speech is clear. So Sarah, I just want you to stand for me for a little bit. If you can just stand up, please. And if you can just stretch your arms out, put them down. Okay, put them forward, bring them in like this. There you go. And if you can walk for me, and then walk back to your seat backwards. There you go, and just have a seat. Perfect. So patient gait is coordinated, patient walk is smooth and well balanced, range of motion, full mobility of her joints, and her work of breathing is normal. There doesn't seem to be any sign of distress. Can you please tell me where you're at right now?
I am at the clinic.
Okay, and do you know what time of the day it is?
It is the afternoon.
Patient is alert, orient ×3 to person, place, and time. Okay, so what I need to do, I need to have a look at your scalp and your head. So am I able to touch you?
Go ahead.
Okay, thank you. Alright, so I know that you said that your head hurts. Can you tell me where it hurts?
Yes, near the back of my head.
Near the back, okay. So I'm gonna palpate your head. I just want to tell me when to stop and where it hurts, okay?
Right there.
Right there? Okay, so this is where you feel most of the pain, the headache, right?
Mm-hmm.
Okay, and okay, so there is some tenderness in the occipital part of the patient's head. There doesn't seem to be any deformity, cephalic, normal cephalic. There is no lesions or mass or lumps. The patient here is thick, evenly distributed. Doesn't seem to be any infestation or foreign bodies. Can I just have a look at your face, please? I'm just gonna look at your brows and your eyelash. Okay. Face structures are symmetrical. There doesn't seem to be any mass, any lesion, any scar. However, on the right lateral aspect along the jawline, there is a red rash noted. Okay, so what I'll do next, I'm going to check your cranial nerve 7, okay, which is your facial nerve. So I just want you to look at me, and I want you to give me a smile, okay? And I want you to give me a frown. I want you to raise your eyebrow, okay? Puff your cheeks, and give me a smile without your teeth showing. Awesome. Okay. So can I just have a look? And these are all symmetrical. So I'm just gonna have a look at the eyes. Just open your eyes, okay? Just look down for me. Okay. Patient eyes seems to be a little bit red on the sclera. The eyelids are red, both eyelids up and bottom. And there is some tears, and it's watery. So there is no discharge or swelling. Okay, if I can just see here. Okay, so now I'm actually gonna go check your ocular motor nerve, and that is your cranial nerve 3, okay? So I'm gonna use my pen light, but let me just have a look at your pupil. Your pupil are about 3 mm, they're nice and round. So I'm just gonna bring a light to your eye, so just look right there, perfect. And I'm just gonna do it on this side too. Do it again on this side. Let's do it on this side. Perfect. So the pupil are reacting to light. I'm gonna hold this pen here, and I'm gonna move it out. And just look at it as they come in, okay? And going out. There we go. One more time. Look at it as you go in. Okay, accommodation is good. So patient is pupils are equal, round, reacted to light, and the accommodation is present. So I think that brings us to the end of our assessment. All